Hey everybody, it's Keith Murphy with Keith Beats Cancer. Yeah, welcome to season 2, episode 1, I guess. I know it's been a while since my last episode. Uh, we'll call it of the last season, and there's a lot that's happened in the however many months it's been since I put out my last video. So let's just back up a little bit. I'm not going to go through the whole series of events, but so I finished up treatment, my radiation and my chemotherapy in late April. I think April 22nd was my last radiation treatment, and rang the bell and all of that, and that was fun. And went through, gosh, it was tough. About a good month of just being in bed, not really wanting to move much. I had some pretty bad burns around my neck from the radiation, and I've lost a significant amount of weight, going on 60 pounds, and it was just really, really tough. Ended up getting a feeding tube put in. And really that's what I've been kind of living off of these last few months is everything goes down the tube. So it's 2 cal formula, it's water every hour on the hour, any medication I crush up and inject into the tube. So you know, it's a different life. From my previous videos, you guys know I really did not ever want to get a tube, but the deal I made with Jen, my wife, was that if it came down to life or death, obviously I would get the tube, and I'm not going to say it came down to life or death, but it was heading in that direction if I didn't do something. I was simply losing way too much weight. So fast forward a little bit, I started doing some speech therapy to learn how to swallow again. You can tell my voice is still a little weird, and that's because just my throat is just weird now. It's going to take a while for, as I understand it, for my regular voice to come back. But at least now it doesn't hurt like hell to talk. When people call me on the phone, I can actually talk with them. I'm currently not on any pain medication at all, which is something I'm really happy about. I'm not doing the fentanyl, I'm not doing the hydro, not really even taking Motrin, to be honest with you. There's still a little bit of pain, but it's totally tolerable, totally nothing that I have to worry about. So fast forward to a few months ago, a month or so ago, I had, well, I guess July, right? Early July, I had my first PET scan done, and post-treatment test, PET scan and CT scan, and it did show that the cancer had moved into a couple of lymph nodes in my chest, in my lung area. That was really a disappointing blow, and it really kind of took the wind out of my sails quite a bit. And nobody likes to hear that they have more cancer or that it's spread. But I had a couple more tests done to confirm what I had and where it was and stuff like that, and what the treatment was going to be. So it turns out they've started me on Keytruda, which is an immunotherapy drug. It's that's the only drug I'm taking is Keytruda. Um, for those of you who don't know, Keytruda, basically the Immuno cells have an off switch so they don't go haywire and you end up with all kinds of autoimmune problems like lupus or rheumatoid arthritis or those kinds of things. Um, Usually your cells have a shut-off point where it knows to kind of keep things in check. Well, the cancer cells exploit that shut-off switch, and they can actually turn it off so that the immune cells don't attack the cancer cells. Um, so what Keytruda does is it slaps a a piece of tape over the off switch for the immune cell. So the immune cell can continue its job of fighting infections and cancers and stuff like that. Um, the downside is one of the side effects to Keytruda could be the onset of certain autoimmune problems. I have not yet experienced any of that. I've only had one dose of Keytruda. I'm supposed to get them once every 3 weeks. I'm tolerating it pretty well. I think first couple of days after my Keytruda infusion, I had a little bit of fatigue, some joint pain, but all in all, it was pretty well tolerated, and I'm back to feeling pretty good. Just recently had to have, or yesterday, as a matter of fact, had to have my my feeding tube replaced. That was not a fun experience. They do that without any kind of anesthesia or sedation or anything like that. So yeah, they just go and I mean, I'm not gonna say they rip it out, but they pull it out, and they're not gentle with it. Um, and it hurt like a son of a bitch. It really did. And of course, they replaced it, and now I have a new one that's not leaking. I did develop a slight infection around what's called the stoma, which is where the tube goes into your stomach. So I'm just treating that right now with some bacitracin and just cleaning it and making sure it's the site is clean. So there's some stinging that goes along with that, but it's it's not constant. And if I had to, I suppose I could take a Motrin or something, and it would help there. But it hasn't been too bad. So I'm for now I'm working on trying to gain weight. I'm actually working on trying to drink through my mouth and not through my tube, although I'm still continuing to drink through my tube as well. This is just LaCroix carbonated. It's that, what is it, the like tonic water with some essence of fruit or whatever. It's pretty good. I like it. Not going to say it's my favorite, but it's definitely better than having a dry mouth all the time, which is the norm. My mouth is always dry. There's different things, mints and different rinses and stuff like that you can do to keep your mouth moistened. I just prefer to have something to drink with me. I still wake up every night with a dry mouth and have to either use some spray or go rinse or something like that. So I'm trying to bounce back from the initial treatment, trying to gain weight. I think I've gained 2 or 3 pounds, maybe 4 pounds so far. So I'm in my upper 150s. Remember, I started this in my close to 220, So that tells you how much weight I lost, greater than 60 pounds. Um, but I'm hopeful, you know. Technically, I'm stage 4, head and neck cancer. Um, and that kind of scares me when you think about stage 4. It's it can be a bad sentence for some folks. I'm not choosing to look at it like that. I'm choosing to just take each day as it comes and rely on the the advice of my doctors, and we'll see how things go. I still think, you know, with Keytruda, that gives me my best chance, and I'm just going to try to live my life and um, yeah, just try to enjoy and uh, be thankful for each new day that I get, because each day that we get obviously is a gift, to spend with your loved ones and your friends and stuff. So um, yeah, that's just kind of where I'm at right now. Sorry for the delay in posting additional videos. I'm not gonna probably post as many videos as I had in season 1, um, but as events warrant, and you know, as progress is made, you know, um, I may jump on and do some additional videos from time to time. But I appreciate everybody, you know, still reaching out to me, still wanting the best for me and praying for me. And, you know, it means a lot to hear from family and friends and colleagues and old work friends and stuff like that. It does put a smile on my face, and it's great. So again, thanks a lot for watching. Thanks for tuning in, and we'll see you next time. Okay. God bless. Take care.